So let's start with her case. So today's patient is a 13-year-old male presented with a cat bite and seems to be non-toxic, and heart rate is normal 96 and BP 110 by 60. Tries to the pediatric patient. So we would start with attaching the monitor. Now let's talk with the patient. So the history given by the parents of the patient is that the patient has a cat bite on the left forearm, and there are two puncture wound in the same area, and the cat has been fully vaccinated and the patient has not received the tetanus vaccine. So basically, first we would just start the patient with cleaning the wound, irrigation of the wound. Next we would give the patient tetanus injection, and for the prophylaxis of infection also we will add antibiotic. With further evaluation, the patient has seasonal allergies which has been medicated with cetirizine, no drug allergies, and let's examine the patient. Normal, ENT normal, cardiovascular normal, respiratory no symptoms, no GI symptoms, normal. So the patient has a bite mark on the left forearm with a minor scratch to the arm. No other injuries reported. And he also has moderate pain in the left forearm, worsens with movement of left wrist. Maybe the patient has any foreign body still impacted in the wound. No allergies. Airway is clear, normal breath, normal circulation. So in musculoskeletal examination, the patient has mild increase in pain with left wrist extension, normal range of motion of the left arm including elbow, wrist and fingers of the left hand, and no gross deformity or bony tenderness, no palpable foreign body, and normal pulse distal to the injury. And the skin shows two distinct puncture wounds to the posterior left forearm. The base of the wound is not easily visualized, no muscle tissue or ligament injury visible, mild surrounding erythema, and no active bleeding. Neurological patient is normal and psychiatric age appropriate behavior are seen. So as we know that the patient is having pain while movement of extension of the wrist, so it may be possible that a foreign body is impacted inside the patient's wound, and to be just sure about it we can perform a x-ray forearm. This is not necessary, but just to be sure. Okay, so there is no foreign body. So now we can just, you already know the diagnosis, cat bite. And we can discharge the patient with prophylactic antibiotic treatment, and here's the diagnosis. Nice.